Hello everyone, my name is Trish, Grooms, and I'm a licensed master social worker. I work as a counselor for elementary students at Texas School for the Deaf. I'm also the interim mental health project coordinator for SOC, the statewide outreach center at Texas School for the Deaf. I've been in the field of human services for over 30 years, and I'm glad that you're joining me today so you're able to have a better understanding of ADHD and how to work with children and teens who have ADHD. So, what behaviors do you see that give you the impression that a child may have ADHD? Is it someone who is all over the place? Or they're always on the go? Is it someone who does things without thinking? Is it someone who tends to talk a lot, perhaps blurt out comments without waiting their turn? Is it someone who appears to not pay attention or doesn't seem to listen? What about someone who lacks self-control, loses their temper, or talks back? Being disorganized, forgetful, loses things? Perhaps these children may have ADHD. However, we need to be mindful that there are other issues that can look like ADHD. For example, depression, anxiety, or maybe other health problems. These can all have similar symptoms and easily mistaken for ADHD. So it's important that the child be evaluated by a medical doctor to ensure that any health issues are not overlooked. Before we move on to the various problems of ADHD and interventions, I'd like to take a moment to explain the 3 different types of ADHD diagnoses. First, inattentive type. Previously, that was commonly called ADD, and there are still some individuals that use that term today. However, the reason why that has been changed to ADHD inattentive type is that there is evidence that there is still some hyperactivity. However, it is not as prevalent or not as noticeable. Inattentive type tends to be more common in girls. Most often, girls are overlooked until they become much older, and other issues may pop up, such as anxiety, depression, lack of organization. It all becomes more prevalent. Those with this type of ADHD are oftentimes what we see as daydreamers. They look like they're paying attention, but in reality, they're thinking about other things. The second is hyperactive/impulsive type. This is the most obvious of the 3 types. Maybe you've heard that statement, "Oh my gosh, this kid is all over the place." That is what we imagine with this type. However, the interesting thing about this type of students is that with this type of ADHD, they can still access information or what's happening around them. For example, a child may be at their chair, restless, all over the place, appearing to not pay attention, but then when someone asks them a question, they're able to respond with the answer. Same thing with watching a movie. They may be all over the place, appearing to not pay attention, but they're still following the plot line of the film. We see this happen with this type. The third is called combined type, having both the inattentive features and hyperactive features. This is the most common type of ADHD. Bottom line If a diagnosis of ADHD does occur, it's best to be aware of what the individual's struggles are, specific to them, so that the accommodations, medication, behavioral support, and coaching, as well as other interventions, can be implemented to suit that individual need. Most ADHD symptoms are similar or fairly common, and therefore there are common accommodations that seem to be effective. However, that's not always the case. Every individual has certain accommodations that are more helpful than others, or perhaps they may have accommodations that we don't often think of that happens to be helpful for them. The etiology of ADHD is not due to bad parenting or an immature personality. It is considered a real developmental disorder caused by genetics or being born premature. ADHD is truly a biological disorder. The frontal lobe of the ADHD brain is less active and less mature. It is also under-aroused. These areas of the brain are less developed, and these are the areas that help with self-control. So, for example, if something happens, perhaps a minor situation comes up with a peer, a child with ADHD oftentimes loses their temper. Their emotions become so big, it almost looks like they're in a rage. Truly, it's just anger, but it's because their brain and the way in which they filter information simply can't process that emotion. It ends up being a triggering situation for them. Self-control is not a skill deficit. The problem is not with a child not knowing what to do. They know what to do. The problem is in the moment they can't access that information. The ADHD brain does not respond quickly when it needs to stop and think. So, for example, perhaps a child is in the class, maybe they're watching a story, and the word dance surfaces throughout the course of the story. And so the child begins thinking about dancing. Oh, I want to dance. I can feel a beat. And then without really considering or stopping to think, filtering out their behaviors, they become impulsive within their thought process. And so they sure enough end up dancing, perhaps on the chair, on their table, or dancing around the perimeter of the classroom. That is just one example. Their brain doesn't respond quickly when they really need to stop and think and consider, maybe now is not the best time to do this. Maybe I should wait until recess or wait until after school to dance. ADHD is multi-layered. Think of an iceberg. Only about 1/8 of an iceberg is visible above the surface of the water. The vast majority of the iceberg cannot be seen. It is beneath the surface. The tip of the iceberg tends to be those obvious ADHD hallmark behaviors, whereas there's other things that are hidden beneath the surface that we do not recognize or are less obvious. The tip of the iceberg encompasses 3 general areas. One is hyperactivity, which can be restlessness, excessive chatting, fidgeting, inability to sit still, or always on the go. The second part of the tip of the iceberg is impulsivity, which can be a lack of self-control, difficulty waiting for turn taking, blurting out, interrupting, telling untruths, talking back, losing their temper. And the third area of the tip of the iceberg is inattention, which can be disorganization, inability to follow through, inability to pay attention. They're forgetful, seem to not listen, easily distracted, makes careless mistakes, loses things, and may not do their schoolwork. Now, the remainder of the iceberg, beneath the water's surface, those are the areas that are not always seen. And that includes a whole host of items. For example, impairment in the ability to control their own behavior within social settings, impaired sense of time, for example, losing track of time, a tendency towards being late, difficulty planning ahead, they hate to wait their turn. Other examples include insufficient levels of neurotransmitters, which helps reduce brain activity for thinking tasks. It can mean weak executive functioning. This is where working memory and recall is affected, controlling their emotions, struggle with complex problem solving. It can include low frustration tolerance, meaning you may see them losing their temper, have a short fuse, giving up easily, difficulty perspective taking of others. They can also have the appearance of being self-centered or selfish. They may do things without thinking or become emotionally reactive. They can also have coexisting conditions, such as anxiety, depression, bipolar, oppositional defiant disorder, substance abuse, obsessive compulsive disorder, and conduct disorder. Also within this, we may see anywhere from a 2 to 4 year delay in development, showing a lack of maturity and responsibility. So a 14-year-old may behave and act like a 10-year-old. And they do not easily learn from rewards and consequences. For example, they may repeat misbehavior, may be less likely to follow the rules. They may not study or learn from past behavior. They need immediate rewards. Long-term rewards are not very effective. They may have difficulty managing their own behavior. And last but not least, those with ADHD can have serious learning problems, such as having poor working memory, cannot memorize easily, they forget requests, have a slow retrieval of information, difficulty with writing essays, poor listening and reading comprehension, difficulty in describing the world in terms of words, difficulty rapidly putting words together, slow processing, poor fine motor coordination, and impulsive learning style. See how complex ADHD is? Unfortunately, those children who have ADHD also possibly could run into some other problems as they become older, including a higher likelihood of teenage pregnancy, a higher risk of drug use or delinquency problems, issues with driving safely, being underemployed or changing jobs frequently. Without a good support system and appropriate interventions, real suffering can occur in life. So it is imperative for these children to get all of the help and support they can get in learning to adapt and live with ADHD. So, what interventions are best for a child with ADHD? 1. A proper evaluation. Make sure it is in fact ADHD. As I mentioned earlier, there are lookalikes. Also, the child could have ADHD and something else, including depression, anxiety, or others. Number 2, educate yourself and your family about the disorder. There is so much false and old information out there. You and your family should have the best information possible. 3. Medication. Families and the child should know how medication works, the side effects, the real effects. Medication works because it stimulates the part of the brain that is underworking and also gives the gift of what we call the 10 seconds, which helps with impulse control. However, be mindful that most of the time it does take trial and error in order to find the right medication. So it's important that all involved be patient and understanding of the process. Number 4, behavior techniques, social emotional coaching, and counseling if needed. Number 5, develop and implement various accommodations for the child to be able to access their education. The goal is to understand ADHD as the problem rather than as a problem child. What teachers should know about ADHD? It is a complex neurobiological disorder. All students with ADHD are not alike. ADHD can also co-occur with other disorders such as learning problems, anxiety, depression, ODD, and others. Impairment in adaptive function is common. Students are naturally more active, less attentive, and more impulsive. Some students are immature and need more time to develop. But there are students who exhibit behavior that hurts them and can prevent healthy development. What general accommodations or modifications might be needed in school? Generally speaking, make expectations clear. Give assignments that are not too long. Give step-by-step directions. Monitor and check for understanding. Provide corrective feedback. Allow the student to move. Give the student a legitimate reason to move. They're going to do it anyway. So for example, having them help the teacher, deliver messages to the office, take a brief exercise break. Give short and simple instructions or directions. Sitting in the front and center of the room away from the door or in close proximity to the teacher. You can use colored tape around the student's desk to allow a space for movement breaks and to remain within that space and encourage them to stay in the boundaries. That's some examples. There are many other types of accommodations that students with ADHD could benefit from. The best thing to do is to do your research, and you'll find a pretty good list of different accommodations out there that you may not have thought of that could be beneficial to that specific student. If you do a simple Google search, you can find a litany of accommodations. There are behaviors that teachers should avoid because that can cause an escalation of misbehavior. For example, nagging, lecturing, to preach at them, so to speak, arguing, putting a student down, sarcasm, harsh punishments, getting in the student's face, engaging in power struggles, punishing ADHD behaviors. I do know that most teachers will not do these things, but often working with kids with ADHD can be exhausting and frustrating and can lead to some negative responses towards these kids. So here's some examples of things you can try to do in order to de-escalate misbehaviors. Having private discussions about behavior. acknowledging the student's feelings. Use active listening. Offer understanding. Make statements in a neutral manner, meaning having a flat affect and explaining in an unbiased way. Suggest an alternative behavior. Have a prearranged crisis plan. Now some tips to address behavior. So we talked about de-escalation of behavior, but how do we address some behaviors? Maybe restlessness or disruption of other students. So one is to provide feedback immediately and providing feedback often. Use powerful and meaningful rewards as well as consequences. Provide positive feedback before negative feedback. Be consistent. Teach skills. Anticipate problem situations, such as lunchtime, PE, or transitions where you commonly see misbehaviors. Keep a disability perspective and practice forgiveness. I would like to share some common tough questions or comments that have been made by teachers and parents over the years that I've worked with as a counselor. It happens more often than you think. One is, the teacher may say, "Oh, that child is so lazy. He doesn't even try. ADHD is just an excuse." That shows an "I don't care" attitude towards that child. And it really covers up a lot of emotional pain. Children with ADHD tend to brush things off in order to mask their true emotions. Another example, students with ADHD don't really need medication. They need to just work harder. ADHD is first and foremost a neurobiological disorder, and medication often is the most effective treatment. When is enough enough? I've tried to help, and she still won't do anything. Keep in mind, ADHD is a disability. Progress is not always going to be a nice, smooth, and upward motion. Expect uneven performance, regression, and shutdowns. These times are most frustrating for the child as well. It's not fair to treat this student differently. That's something that one teacher told me previously. Being fair is giving the students what they need in order to succeed. It's important to give them tools to be successful. I had a parent tell me, "Help me, I'm losing my child." Raising kids with ADHD is tough, and so is teaching them. The difficulty is that kids with ADHD have an increased need for guidance, protection, advocacy, love, and nurturing. This need can be hidden behind that child's excessive, demanding, and obnoxious behavior. Something to think about. We often try different things and can become frustrated when it doesn't work. So when you're using the same techniques that seem to work for one child in general, oftentimes that may not work for another. This happens more often than you think. Every student who has ADHD responds differently to different techniques. They also will seem like they're responding to certain techniques because of the novelty. Once that novelty wears off, you may see the return of old behaviors. So it's important to change things up to keep them interested and engaged. Things that generally do not work for kids with ADHD are things like giving consequences at a later time, giving warnings about what will happen later, expecting organization and planning without support, or giving them full responsibility for homework. Things that generally do work for kids with ADHD are as follows: giving immediate feedback and consequences, using incentives rather than punishments, externalize time and bridge time when necessary, externalize the important information at the point of performance. For example, perhaps you go to the grocery store, and before you go into the store, having that discussion with your child or student and explain to them the expectations. We will go into the store and get these 3 items. We will not be getting candy. I expect you to follow these rules, and if that does not happen, we will leave the store right away. So giving them that information prior to, rather than when you're at home or prior to the transition, but actually do it at the point in which that information needs to be applied. Make thinking and problem solving more physical. Act, don't yak. Plan ahead for problem situations, such as unstructured time, field trips, or changes to routines. Don't personalize the behavior. And again, practice forgiveness. Remember, the child who needs the most loving will ask for it in the most unloving way. So look on the positive side. There are some good things about ADHD. Lots of energy, willingness to try new things, ready to talk, and talk a lot. They can get along with others, can do several things at one time, need less sleep, have a good sense of humor, very good at taking care of younger kids. They can be spontaneous, see details that other people may miss, can think of different and new ways of doing things, volunteer to help others, eager to make new friends, courageous, fun, loving, quick to forgive, genuine, never boring, and interested in new and novel things. Now let me give you a visualization of a child with ADHD that might be helpful in giving you an idea of how ADHD can impact the child in succeeding in life without supports and accommodations. When a child has ADHD, it's as if the child is walking down the railroad tracks of life. And it's as if they have an opaque curtain hanging in front of the child. And that curtain ends up obscuring the child's view of the track ahead, meaning the future. His or her view is very limited of the nails or even the smashed pennies right on the track in front of them. It means that they're focusing on the here and now only. Whereas further down the tracks, the child cannot see the upcoming railroad crossing. That railroad crossing can be a due date for a project. And they also cannot see the train that's coming from the other direction, which can become a major crisis. So they can't see those things. They're focused on the here and now, which can cause disruptions down the road because all of those cues, that information that they're supposed to have in order to prevent things from happening, can be overlooked. So knowing that, I have had students that have shared with me that once they've begun taking medication for their ADHD, they feel like they're no longer in a fog. That cloud that was in their way is no longer there. They feel that they're able to have more clarity and oftentimes recognize how much information they had missed in the past, whether it be social cues or other details. And they can actually become overwhelmed with the amount of new information. They actually end up becoming more engaged, more motivated, as they're able to better internalize what they've learned and not have to rely on external things or rewards. They also learn how to use adaptive tools in order to organize and plan better. With counseling and social emotional coaching, students with ADHD can develop or improve their social and academic skills in general. Children with ADHD need you to bring the future into the here and now and model the necessary skills to compensate for deficits, involve an organization coach, provide accommodations, and love them anyways. If you need more information or resources, or you have questions, first thing I recommend is that you reach out to your local school counselor or your physician, or if you already have access to a counselor, they are the best people to inquire to about ADHD in general. Be careful with researching ADHD online. There's a lot of false information out there, but there is still quite a good bit of useful information out there. You can look on the website for other texts or books that may be helpful to you. We have some children's books that students, parents, and teachers will find helpful. We also have some web links available for you to access with a variety of information. You can also get weekly information as well, so please take a moment to look at those links and lists of resources for yourselves. Thank you.